Hello everyone and welcome. In today's video, we're going to walk you through one of the most commonly used techniques in phlebotomy, blood collection through venipuncture. Specifically, we'll be demonstrating the butterfly method, also known as the winged infusion set technique. This method is especially useful when working with small or fragile veins, like those in the hands or arms of pediatric or elderly patients, because it allows for greater precision and control. The butterfly name comes from the two flexible plastic wings attached to the needle, which the healthcare provider uses to guide the needle gently into the vein. Whether you're a student, a new practitioner, or just curious about the process, you're in the right place. We'll take you step by step through the procedure, covering key safety tips and best practices to ensure a smooth and successful blood draw. So let's dive in and get started. The very first step a phlebotomist or medical technologist should take is to gather all the necessary equipment for the procedure. This is an essential part of preparation. It ensures that everything is complete and ready, so when it's time to perform the blood draw, everything is in place and there's no need to rush or look for missing items. For this procedure, here are the items we'll need: the patient's requisition form, vacutainer tubes for blood collection, alcohol for sanitizing the site, cotton balls, medical tape, a tourniquet, the wing infusion set, commonly known as the butterfly needle, and of course, a syringe. Having these items prepared ahead of time helps ensure a smooth, efficient, and safe venipuncture experience for both the patient and the practitioner. Next, it's important to approach and greet the patient warmly to help create a calm and comfortable environment. After the greeting, clearly explain the procedure to be done. Also explain the type of test they'll be having and ask a few essential questions, like whether they've had any issues with previous venipunctures, if they have any latex allergies, and if they have a preferred site for the blood draw.
Good morning, sir. I am your phlebotomist, Michael Luis Emperador. And ikaw, sir, what's your complete name?
I am Nino Christopher A. Magamid.
So today, sir, I will be collecting your blood sample through the butterfly method of venipuncture, and it is specifically for the test APTT, the activated partial thromboplastin time. So before anything else, sir, before I proceed, may I ask if you have any previous problems with venipuncture?
Not that I know of.
How about allergies, sir? Are you allergic of latex?
Hindi naman.
So, mag-start na to, sir!
Before proceeding with any part of the procedure, it is crucial to sanitize your hands thoroughly. This step helps prevent the risk of infection and ensures that the patient's puncture site remains uncontaminated. It's highly recommended to perform hand sanitization in front of the patient, not only as a standard practice, but also to provide visible reassurance that your hands are clean and that you're prioritizing their safety. Once your hands are completely dry, the next step is to put on a fresh pair of gloves to maintain proper hygiene and prepare for the venipuncture procedure. Next, properly position the patient's arm on a flat, comfortable surface, ideally with the palm facing upward. This helps stabilize the arm and makes it easier to locate a suitable vein. Then, apply the tourniquet around the upper arm to temporarily restrict blood flow. This increases venous pressure, making the veins more visible and easier to palpate. Be sure the tourniquet is snug but not too tight. It should be firm enough to make the vein stand out, but not so tight that it causes discomfort or cuts off circulation. Once you've found a vein, gently release the tourniquet. Clean the preferred site. While waiting for the alcohol to dry on the puncture site, we can start preparing our infusion set. In this procedure, we'll be using a butterfly needle, which will be connected to a syringe. Start by opening the syringe and checking if the plunger works properly by aspirating it 3 times. This ensures that it moves smoothly and is functioning correctly. Once done, prepare the butterfly needle by first removing the cap from the lower lock connector. Then, carefully remove the needle cover from the syringe. Next, connect the syringe hub to the lower lock of the butterfly needle, making sure it's securely attached. Once assembled, place the syringe with the butterfly needle on a clean, dry surface and set aside the unused needle safely. After preparing all the materials, reapply the tourniquet just above the selected site. At this point, it's important to remember that once your hands have been sanitized, you should avoid touching the clean puncture site unless you're already wearing gloves. Locate the vein you previously identified, and once you're confident with your choice, gently pull the skin below the site to help puncture the vein. This prevents it from rolling during needle insertion. With a steady hand, carefully insert the butterfly needle into the vein at a shallow angle, ensuring the bevel is facing up. Proceed gently and smoothly to minimize discomfort for the patient. Once you see blood flow into the cannula, gently apply pressure to the cannula to ensure the blood flow is smooth and steady. Wait until the blood reaches the lower lock connector. Once the blood is in the lower lock, slowly pull the plunger of the syringe to begin collecting the blood sample. Be sure to collect the right amount of blood needed for the required test, as over or under collecting can affect the accuracy of the result. After successfully collecting the required amount of blood, grab a cotton ball and place it gently over the puncture site. Then, carefully remove the needle from the vein. Once the needle is removed, instruct the patient to apply gentle pressure to the site to stop any bleeding and help prevent bruising. It's important to remind them to keep the pressure on for a few minutes. Be sure to hold the syringe properly to prevent any blood from spilling during the transfer. Carefully detach the lower lock from the needle and immediately place the needle back into its packaging. Do not leave it exposed or discard it improperly. Next, grab your Vacutainer tube and carefully transfer the blood into it. Ensure that the blood slides gently into the Vacutainer, rather than squirting it directly. To avoid any air bubbles or damage to the sample, once the blood is inside, seal the Vacutainer tightly and invert it gently. For a sodium citrate Vacutainer, perform 3 to 4 gentle inversions to mix the blood with the additive. Finally, label the tube with the necessary patient information and test details right away to avoid any confusion or mishandling of the sample.
After a few minutes, check the puncture site if it's still bleeding, then apply bandage.
Once the procedure is done, don't forget to thank the patient for their time and cooperation.
That's all, sir. Thank you.
That concludes our demonstration of the butterfly method for blood collection. We hope this guide has been clear and informative. Thank you for watching.